Hi, I'm Dr. Philip Chang. Today what we're going to be talking about is how we do a PRP hair restoration. They're actually able to grow hair where they've lost it, and some of those hairs might just be kind of in a dormancy phase. So what this is doing is it has growth factors in it, and we take those growth factors from your own blood, and that's what she's doing now. So she's taking a few test tubes of blood from me, and hopefully I don't faint. What she's going to be doing is taking that blood, we're going to be processing it in the back, and we're going to be putting it in a centrifuge. We're going to centrifuge it twice. The blood will actually separate. So it's going to separate into a blood component, a plasma component, and a platelet component. We're going to take out the blood component and hopefully just leave the plasma and the platelets. The second time we centrifuge it, it's going to be centrifuged for about 10 minutes. And what that's going to do is it's going to break up some of those platelets. The actual growth factors are located inside the platelets, and so when the platelets break up, the growth factors are released. Now it's going to separate out into a small blood component, and then a layer that's called the buffy coat. That's where all the growth factors are located, and then the rest is plasma. But even in that plasma, there's still some growth factors, so we actually want to keep some of that plasma too. Then we take that and put it into little small syringes, and then we actually just inject those growth factors directly into, in this case, my head. So what we're going to be doing is we're going to put PRP into my scalp and hopefully grow some hair. Okay, so this is what the vial looks like after the first spin. What we've done is we've spun it for 5 minutes at 2,700 RPMs. And you can see that it's separated into a blood component and a serum component, which has the platelets. And so what we're going to do now is separate these two and put it into another test tube and centrifuge it again so that we can only get the platelets and the growth factors in it. So you can see that right there. What you can see now is blood component at the bottom, and you can see that white layer in the middle. That's all of your growth factors. We call that the pellet, and then there's serum on top, but we don't want to throw away all of the serum because there's actually some growth factors in there too. So what we're going to do now is remove the vast majority of that serum, and we're going to just leave a little bit. That's going to grow all of my new hair. So she actually numbed up my head, injections of lidocaine and marcaine, which should last for about 4 to 6 hours, basically across here, and that really didn't hurt at all. I told her to concentrate on the areas where I still have hair, but it's thinning. She's also going to do the areas of my temple where I've actually kind of lost it. Both should grow. It's been shown to be better where it's actually thinning and not necessarily gone. Both are stimulated by the growth factor. You need to do it 3 times. I'm going to have another one in 4 to 6 weeks, and then another one in 4 to 6 weeks after that. You won't get any growth until after the second treatment. Or after the first one, definitely not. After the second one, it's been shown to grow about 30–40% more thickness. And after the third one, that's kind of the maximum effect. And then once a year. So why would you do this instead of a hair transplantation? This is completely non-surgical. There's no recovery from it. Matter of fact, I'm going out to dinner tonight. If I can get any form of growth out of this, I'll be ecstatic. I think this is a great solution for anyone that wants more hair, completely bald spots. This might not be the procedure for you, but certainly if it's thinning, it's a great solution. Now you know how it works.